Hi, good afternoon. My name is Carlos Acosta. I am a fourth year medical student at the Federal University of Health Sciences of Porto Alegre. And today I'm presenting to you a clinical case on hematology, a part of the daily activities we have in the Judith Sclears program of medical English. I've been studying with her for the last year and a half, and I hope you all can see the results in my learning.
This is the clinical case of a sleepy hairdresser. About our hairdresser, she is 26-year-old, Caucasian. Her chief complaint is tiredness. History of present illness. 3 months ago, when she was late for work after sleeping through the alarm clock, despite having had an early night, she says she has been feeling tired most of the time, regardless of the amount of sleeping she's having. She's struggling to make it through a full shift at work. She works from 9 a.m. to 3 p.m. The day before she came to the consultation, she said she fell asleep during her lunch break, and the manager told her she needed to get a checkup by the doctor. So that is why she's here consulting with us. And she also complains that she's not got much of an appetite. So, about her past medical history, she says she has some eczema, but no other medical problems, and she doesn't take any current medications. She has smoked marijuana in the past a few times over the last months, but she doesn't take any other recreational drugs. About her social history, she lives with her boyfriend in a flat, and she works as a hairdresser. She has never smoked and cigarettes, and she only drinks at weekends, maybe 6 to 8 units. There's no illness that runs in her family, and the rest of items in the social history were unremarkable. So, do we have any questions for our patient? The most remarkable habits that we interviewed her on were the sleeping habits and the appetite. When questioning about sleeping habits, we've said, or she's responded, that she's been sleeping around 14 hours a day, which is far more than the 7 hours she was sleeping a few months ago. And it didn't suddenly switch to 14 hours. She's been gradually increasing the amount of hours she sleeps over the last few months as well. She is not taking any regular medication or anything over the counter. About her appetite, she seems to feel full quicker than usual. She hasn't had any vomiting, and her bowel movements haven't changed at all. She goes on average once a day, and there's no blood in her stool. She refers weight loss, but she's not sure by how much. She hasn't noticed any abdominal pain, and no acid reflux type symptoms. So when we questioned her about recent illness, she said that bruises appeared in random spots where she doesn't remember hurting herself. There was one or two on the last week, but this week when she came to consultation, there was about 6. She doesn't have periods because she has Marina coli, and she hasn't noticed any particular thirst or passing more water than usual. She also hasn't noticed any cold intolerance or memory problems. So, what systems would we identify with this case, and why? Through the inspection, general inspection, we noticed a conjunctival pallor and multiple patches of petechial bruising across the limbs and trunk. In our cardiovascular and respiratory system evaluation, we see the pulse at 95 beats per minute, regular, capillary refill time greater than 2 seconds, heart auscultation, normal heart sounds with no added sounds. In her lung auscultation, good air entry, no crackles or wheezes, resonant or percussion. for her gastrointestinal system and lymphoreticulator system. In her evaluation, we analyzed no gross abdominal distension on inspection. And on palpation, the abdomen is soft with some tenderness in the left upper quadrant. On deep palpation, you note some fullness in the left upper quadrant. In lymph nodes palpation, we noticed 2 enlarged cervical lymph nodes, and all other fields of exploration are unremarkable. So after the physical examination, we go to the laboratorial exploration, and we ask for our patients a complete blood count, which came in with all results altered except for the medium corpuscular volume of 90. Besides that, we have general augmentation on neutrophils, basophils, eosinophils, and we have detected myeloblasts. We also have coagulation tests in which we see an alteration of the platelets, harm reduction of platelets. We also ask for random blood glucose, which came normal. Thyroid function tests, which are unremarkable as well, and virology which is negative. Additional to this, we asked for a blood film, which shows increased number of neutrophils, basophils, and eosinophils, as well as an increased amount of immature myeloid cells. Overall, this refers or gives a hint of leukocytosis.
So now that we have the physical examination and our initial evaluation of our patient, we can then start thinking about the probable pathologies that are interfering with her life. In this case, we have 2 main clinical remarks. The first one is her loss of appetite that we can also relate to the findings of abdominal tenderness and the physical examination. And the second one is her tiredness, which we can relate as well to the amount of young cells and myeloblasts found within the complete blood count. And with these informations, we can then try to investigate differential diagnosis within our patients. So what would be your first diagnosis?